So I've been asked a lot of questions. How is OBGYN going? How are you doing in OBGYN? Are you enjoying OBGYN? And I'm just like there like, yo. Anyways, sit back, relax, and let's go. Hello and welcome to Hospital Survival Guide. This is season 2, episode 4. This is a series on my YouTube channel where we actually look at how to survive the hospital environment, how to prepare for medical internship, how to survive when you're in the hospital as a medical student, as a newly graduated doctor. It's a Saturday and it's really chilled. It's really chilled. Don't you guys really think that it's chilled? You don't? Maybe on call. I'm not on call, so probably on call tomorrow. You know, these call days, yo, Jesus Christ, they're happening every single time. So you actually get asked a lot of these questions, as in, why are you not enjoying OBGYN? Are you really loving the department? And I thought to myself, maybe I should actually do a video on how OBGYN is actually going. So this is my 5 things to surviving the obstetrics rotation, specifically obstetrics, because update, I'm still currently in obstetrics, and long story for another day. So the very first thing that you need to do to survive obstetrics is, of course, know when to ask for help. I think that's the biggest issue that most people actually face in obstetrics and gynecology. Suppose you see a patient and you do your vaginal examination and you realize that, oh, I'm feeling something that I've never felt before. And you have 2 choices. You could either listen to the angel on your right side, and like, oh yeah, ask your senior, ask your friend. Or you could listen to the devil on the left side of your shoulder, like, it's probably okay, just ignore it. So if you end up listening to the devil on the left shoulder and you find out that you've actually missed out a very big thing that you're supposed to pick up on your examination, then a bad outcome for both the mother, a bad outcome for both the fetus. So that's actually a bad thing on your part as a doctor. If you listen to the angel on the right side, probably maybe you may feel embarrassed to ask your colleague for a certain thing. You may feel like as if your senior may look down upon you, but it's part of the learning process. That's one thing that people don't really acknowledge when they're in the obstetrics department. The very fact that they are learning, it's a continuous learning curve. It's a continuous learning development. So getting to ask for help actually is the one thing that has actually helped me survive so far in the obstetrics rotation, and I could say I'm surviving. Am I enjoying it? Stick around and I'll tell you the answer at the end of this video. If you haven't yet subscribed to the channel, what are you waiting for? On our road to 10,000 subscribers, hit the bell notification icon while you're at it. Drop a like, drop a comment so that you can be receiving such amazing content every time I post. Tell a friend to subscribe to the channel. I mean, how hard could that be? So the first and foremost thing is that when you are actually in the obstetrics department, it's a department where you value mothers and you treasure mothers. It's even written like in the antenatal card, no woman should die in labor. Now, imagine, I'll come to this at the very last bit of my video, where we actually had a very horrible experience, and I'll tell you about this horrible experience. It's like a story for the end, so stick around for this story for the end. So you should put yourself in a position where you're actually asking for help from your colleagues, you're asking for help from your seniors. If, for example, you have done a vaginal examination and you're not so sure about what you're feeling, you could ask your friend, oh, can you please come and confirm this? So I'm not saying that please call the whole world to come and do VEs on this woman, because you don't want pretty much infections. That's the word I was trying to actually look for. So always make sure that you inquire through someone who you actually trust. That's the first thing. Ask for help. Learn when to ask for help. The second thing that is actually with obstetrics department and actually surviving in the obstetric department is having a good memory. What do I mean by having a good memory? Obstetrics and gynecology is a department where you can actually have one particular patient that can actually keep you busy for the rest of the night. You can have one patient and you're busy the rest of the night. Sometimes there are some elements where you actually have some quiet calls. So when you're actually on call, meaning you're in the department from 8 hours to 8 hours the next day. You're going to be receiving women that come in labor, women that come in with complications that are referred from other facilities. So each woman that actually enters into labor, remember that labor has different stages. This is not really a lecture, so I'm not going to go into that. But you're going to have to monitor these women at these particular stages of labor. When they're in the latent phase of labor, for example, you're going to be monitoring them every 6 hours. If they're in the active phase of labor, you're going to be monitoring them every 4 hours. And keep in mind that you do not have to forget these reassessment times. Once you forget these reassessment times, it means you have messed up the whole thing. Moreover, worse off, if the patograph is actually opened and you realize that you missed the assessment and this woman hasn't progressed. Now, what do you do to actually correct that mistake? You're now caught between a rock and a hard place. It's either you could lie and control the situation. We do not advise for that actually. Or you could ask your senior and risk being shouted at for actually forgetting, mismanaging the patient. And the implication of this could mean that there may have been something that would have been done for this patient before they reached that particular point. For example, if it's a prime gravida, membranes haven't yet ruptured, you could have ruptured the membranes when you actually assess that patient on the prior assessment, but then you forgot, and then now it's way past time. You can't even rupture membranes right now, and you can't even augment this patient. So the only possible place is probably to take this patient for cesarean section. This is just an example. So if you find yourself in such a situation where you actually forget the reassessment times, it makes it very hard for you to actually survive, especially on cold days. You find out that you miss a lot of patients, and in obstetrics and gynecology, we do often hand over patients because it's a specialty where patients are in labor for a period of time, and they may be in labor, like for example, they come after midnight, and you may want to hand them over to the next team that's coming on call. So now, if the next team that's coming on call doesn't really have proper details of this patient, and you forgot where you actually placed this patient and which room you placed this patient, it becomes very difficult when they actually discover. There are some teams that are really petty. I'm not going to say anything, but I know if my colleagues are watching this video, I just say, saving labor ward. They already know who he is. Saving labor ward, wink wink. Anyways, so they will definitely call you back to say, no, you didn't hand over this patient, come see your patient, come review your patient. And imagine you're post-call and you get called to actually come back and review your patient. It's not a good thing. It's not a sightly thing, and it's a very bad thing, and it shows a bad look on your unit. It shows a bad look on you as a doctor. So you should be able to remember the reassessment times. That's the second thing. And how do you do this? We have a board where I work. We have a board where we actually write everything, the doctors that are on call, the reassessment times of each patient, the inductions of each patient, and such that once you do this, and if you're even writing it on a piece of paper, or you can even set a reminder on your phone, it actually helps you know that, okay, at such and such a time, I have to go do reassessments of the patients in active phase of labor, or I have to go do reassessments of the patients in latent phase of labor. That way you don't miss any reassessment, and patients are seen at the right time, and interventions are actually instituted at the right time. So that's the second thing. Now, the third thing in relation to surviving obstetrics and gynecology is pretty much knowing procedures. They won't allow you to leave the department if you don't know how to carry out a cesarean section, because the thinking is that if they refer you to another hospital, they refer you to another place, maybe in the rural areas where you're the only doctor that is able to actually provide cesarean section services, which are pretty much a relief service that you can offer to a mother, and you have no idea how to carry out the cesarean section. It actually creates a very bad image for you. And people, when you go to the village, guys, people think like as if you are the Messiah. I'm like, yes, the doctor has come. A patient that may have had the problem for like years back, they have this growth that they've had for like 16 years. Immediately they know that there's a doctor at the hospital. They'll come to the patient, to the hospital to actually look for your particular help. And then if you are not able, or you're not well equipped, or you're not well trained to actually provide those services, they end up beating you up. Or worse off, if you're in an area where there's a lot of witchcraft, they'll end up doing some black magic on you. I'm not really going to go into that. It's also another story for another day when we talk about these places and we talk about rural posting. I guess we'll get some people to jump on the channel that have actually experienced such things. So generally, you should know how to do certain procedures, like basic procedures in the wards, suturing especially. You should be able to pretty much go in theater and be able to do the cesarean section, or to perform vacuum deliveries. Those basic things that you actually learn in school, you should be able to do them even in the rotation. Even if you don't really know how to do them, you should have this as an opportunity to ask your seniors, to ask your colleagues to actually show you how to do this. And once you actually do them and you're used to them, it actually makes you a better doctor. Even when you're sent to the outskirts of the country, you're able to provide those services confidently. So number 3 is being able to actually provide these basic services. Then number 4 is, of course, being nice to the midwives. If you're working with a midwife that is good, they will teach you, and they're the patients they're the people that are most experienced. Because imagine this, how many deliveries have they conducted? Quite a lot. How many people have they seen in labor? Quite a lot. So if the midwife tells you that, oh, this patient is probably not going to progress, take this patient for cesarean section. Don't be so big-headed. No, I'm a doctor, 7 years, I've gone to school, MBCHB, blah blah blah. Throw that in the dustbin. It doesn't really count. Experience is the best thing. So if the midwife actually urges you that take this patient to theater, and you hesitate and things go bad, trust me, they do record. They'll be like, yeah, doctor informed, and he said that he was not. This guy's report everything. Doctor informed, and he said that no, patient can deliver. And if worse off, that mother actually dies, then it becomes a big problem on you. And remember, OBGYN has a lot of talking, a lot. I wonder how people that intentionally want to be in this department actually love the department. Maybe is it because of the hospital where I train? Maybe it's different from your hospital. Please share your experience in the comment section below, how it is at your hospital, how the department is. Are there people that talk a lot? Are there people that criticize your work? Let us know in the comment section below. And the 5th and final thing, this is a very short video, I know I wasn't going to take much of your time, but the 5th and final thing in surviving obstetrics and gynecology is, of course, having the patience. Being patient, guys. I'll take you guys one day on I'll do a vlog video for you guys one day as I'm preparing for the new channel. Of course, we are putting in works to start up the new channel, but I'll do a vlog of a typical day or a typical week in my obstetrics department. I'll do. If you guys want such a video, please drop a comment in below and tell us that. So be patient. In Obs and Gyne, there's a lot of things that come into play. You get those women that are so young and pregnant, and they haven't really experienced labor before. I don't know how labor feels. I don't know how it's ever going to feel. Even if I got a uterine implant or whatever, I would never feel how it actually naturally feels for the women. So this is something that I can't really say that I am being judgmental or someone is overreacting. It's something that is subjective. But guys, there are some women that you really need patience with, especially those that come in that are very young and they are pregnant. The prime gravidas that are in labor, they are so difficult to examine. It's very easy for you to lose your patience. It's very easy for you to walk away. But remember, you are the doctor that's seeing this particular patient. Imagine if it was your sister. Imagine if it was your wife and someone else walked away from examining your wife because your wife was being too difficult. So have some patience. Yes, of course, the volume of patients sometimes may be too large, such that you don't want to spend so much time on this one particular patient. And if this patient is making your life so difficult, you end up shouting, you end up slapping. There's a lot of slapping, I think. There's a lot of slapping, not even I think. There's a lot of slapping because women sometimes are so difficult. You guys need to give us credits. Every single male individual that is working in the obstetrics and gynecology department, you really need a holiday one day. You really need an award-giving ceremony for all the obstetricians and gynecologists that are male. You have the patience to actually deal with a lot of women, because women sometimes, we appreciate you guys, yes, but you all know yourselves. Even the women that are in the department often complain about the women that are coming to the department. So it's a continuous thing, and we're continuously learning in the department. But develop the patience for the patient, develop the patience for the seniors. Sometimes the seniors may blame you for decisions that they made. Suppose a patient comes in and you in your heart, you're like, this patient really needs to go to theater. You even suggest that to the senior. Then the senior disregards whatever you say, and then complication actually happens during the labor process, and then this patient ends up going to theater, or something even worse, this patient ends up having a poor neonatal outcome, or worse off, the patient actually dies. So if of patients actually dies, remember you are the first person that sees the patients as a junior. So obviously the seniors are going to throw it to you. No, it's the intern. It's always the intern's fault. I don't know why, I don't know how, but it's always the intern's fault. Even if you do everything right and it's the senior that messes up. Who gave oxytocin to this patient? It's the intern. who cut this umbilical cord? It's the intern. Who sutured this patient? It's the intern. Meanwhile, it's the resident. Just know when the consultant comes and asks, who did this? Then it's most likely that whatever you've done is rubbish. Whether you are the senior resident medical officer, the junior resident medical officer, or the STP or the registrar, just know if the consultant asks, who did this? It's either you have done a very good job or you have done a very, very bad job. And most of the times it's obviously a very, very bad job. So you should have developed the patience for your seniors and actually be ready to take the blame for some things that may not necessarily be your fault. Be ready to take the blame for things that are out of your control. I mean, there was one time where patients didn't really have investigations. They didn't have results. And the funny thing is that our lab doesn't do those results. I mean, how is it my fault that, I know this is not a venting video, I'm not venting, but I'm just telling you guys what the experience is. How is it my fault that the lab that is run by other people that I have no influence over are delaying to do the test, or they don't do this particular test, the patients don't have money? What am I supposed to do as a doctor? I've literally done my part. I've seen the patients, I've clicked them, I've ordered for the investigations, written the necessary forms, but yet the patient doesn't have money, or the lab at our institution doesn't run those particular tests. How exactly am I supposed to deal with that? How? So it's like they want you to actually carry out the impossible. We've actually reached some extent of actually using our own money to pay for patients just so that they could have results, using our health insurance to carry out certain investigations such that these patients can actually have results. We've done it before. It will be just crazy when you get back the results and you're doing HCG levels and they see that the gender is male. The guy at the lab will obviously be super confused. But anyways, have the patience for your bosses and be ready to take all the mistakes that they actually throw at you. And another thing that you really need to have a lot of patience in, especially in the obstetrics, is the learning process. The learning curve is actually quite steep. The number of procedures you have to learn, the maneuvers that you have to do. You know, there's some in obstetrics, if you don't know these special techniques, which I'm not going to mention in the video because this is on official record, it may actually look like as if you're not working. We know all your friends who are doing those special techniques, and quickening the process, one could say, will look like as if, yeah, these people are the ones that are working and you guys are not working. You are hiding patients, you're not pushing patients, and you're not seeing the patients right. Meanwhile, we know what the rest of the group is actually doing. So that's one of the things. You must be patient with the process, learn the adequate skill, be able to carry out this adequate thing, and have the patience for the job, because it's so tiring. You're on call, you're almost awake the entire 24 hours. I haven't done any other rotation where I'm actually awake the entire 24 hours. You actually get some spaces in between when it's quiet and there's absolutely no patient. But in Obs and Gyn, just when you clear the patients, you just hear the bucket comes and the suitcase. I'm even starting to hate those buckets when I see them, because they give me PTSD every time I see them. I always imagine it's a patient that has come in labor. Yeah, but it has also given me a newfound respect for women, because I see what they go through, and the fact that I'm here and alive, and the possibilities that my mother would have possibly gone through during labor and the complications she would have gone through, I'm very thankful that I'm actually quite here. So it actually gives me a newfound perspective of how to respect women, a newfound perspective of how to actually look at my mother, and I view her in a very different way. So I love you, Mom. Big shout out to my mother on this particular video. Then, so yeah, have the patience for the fatigue, have the patience for getting used to the system. The biggest thing, or the most different thing that happens in Obs and Gyn, and I'm sure most of you have actually experienced it, the one thing that they tell you when you come to the department is, a woman should never die on your shift. In labor, whatever the case, don't let the woman die. So this was actually quite a traumatizing experience when I actually saw this woman die for the first time in labor. Like it wasn't like the usual deaths that usually happen in internal medicine when the patient has been sick for some time, or some other department like pediatrics or surgery where the mortality rates are quite higher. Obstetrics, you don't expect a woman to die because labor is not a disease. So the first time that I actually experienced a maternal death, it was, I think, when I was relatively new in the department. I had done, I think, maybe 2 or 3 calls, and it was just before handover. Imagine this woman dying just before handover, and there was a lot of chaos that day. I don't want to go into details of that particular scenario because it's going to bring me a lot of PTSD, but just a big heads up for you guys that are going to the department. Yeah, deaths there are taken really, really seriously. If you have experienced them from another department, it's nothing compared to what you're going to experience, especially in the obstetrics and gynecology department. So those are the 5 things and the 5 tips that you really need to learn on how to survive the obstetrics department. If you did enjoy these tips, please subscribe to the channel, hit the bell notification icon so you never miss such amazing content every time I post. To Zambia and beyond, my name is Dr. Moses Kazevu. Until next time, bye-bye.